I want to talk to you about the temporal mandibular joint for a moment and show you a little something there that we call Mr. Jaws. Now, Mr. Jaws shows us that with the joint here, we have the temporal mandibular joint is the only joint that has two joints on either side of the body, and it stops at a hard tooth surface interface as opposed to be one interaction. So it's a very unique joint in the body. So there has to be an intricate balance between the slings that hold this lower jaw to the maxilla, which are the muscles, and the joint and the teeth. So when I talk to people about the temporal mandibular joint, or TMJ, I talk to them about the muscles, the joint, and the teeth. And when everything's working properly, that joint slides with the jaw as the teeth open and close together. And that's a balanced situation. When people's teeth are out of balance in one way or another, if their teeth don't mesh up when the joint is in the right position, then they will create either wear on their teeth, muscle tension, where they'll get facial pain, wake up in the morning with a jaw ache, get headaches and migraines, or they'll get joint problems where they'll start to get clicking and popping. So what we have to look at as this complex is, well, can we go in, reposition the teeth, either with braces or with some level of restoration or adjustment on the teeth, such that this complex is now back correctly working properly. So it's very common when we have muscle and joint problems that we can correct those with the teeth by aligning them properly. And we do a lot of that work. And whenever we do that, we always do a phase 1 or orthotic phase in a temporary plastic material. We are the only office in the area that has what's called the Myotronics K7 instrumentation. What that is, it's a computerized scanning instrumentation where we look at the way the teeth come together, the movement of the joints, the joint noise, and the muscles. Just like your cardiologist will do an EKG on your heart, we do EMGs on your muscles to test the muscle readings. We see where the muscles are hyperactive and irritated. We then go in and relax those, find the most relaxed, stable position. We record that position, and then we have your teeth function in that position for a period of time. And that will end up relieving the symptoms of discomfort. We'll get that clicking and popping to subside and get back into position. And so it's a very good treatment modality and very important for a lot of people who are in discomfort. There's a lot of people who don't have pain or discomfort, yet they're wreaking havoc on their teeth because of things being out of balance. So sometimes people develop facial pain. Other times people don't have any pain at all, but they really wear their teeth down. So both of those people are essentially have the same problem where their joints, their muscles, and their bite are not in balance. And we treat them similarly in that we find that balanced position through the K7 instrumentation. We record that position, and then we'll put in an orthotic, just like you would sometimes wear an orthotic in your shoe to reposition your foot for the posture. This is a similar situation. We'll put an orthotic in the mouth to reposition the posture so that when you bite, the muscles and the joints say, ah, this feels right. I feel like I have a home. And then, after we've confirmed that, we then can take that plastic temporary appliance, remove that, and permanently position your teeth to a long-term, stable, healthy position where the muscles and the joints and the bite are all in balance. And the way we do that, again, is either with braces, moving the teeth to that position, adjusting the teeth, or restoring the teeth with restorations, typically porcelain restorations, to whatever level that is required. And sometimes we do a combination of those things where we will do some restoration and some orthodontic movement and whatnot. So it really kind of depends upon the person's case. But really, really fun level of dentistry when we're able to help people with those types of problems.